So I've got to talk about the age of when perimenopause, menopause starts, because there is a lot of conversation about this. But guys, I need you to understand a few things. If you don't know, I'm Dr. Wendy. I'm a physical therapist. I've taken care of women for 20 years. And perimenopause is the hill I am stuck on in writing my book because there's so much information people don't know and I can't take it. Now this commenter was talking about her family. And she was saying about her grandma at 56, her mom at 53, her aunties between 52 and 55. But here's the thing. That's her family. So your menopausal age is determined by a couple things. One is genetics. One is your family. When did your family go through it? The other thing is, remember that menopause is ovarian insufficiency. When you run out of eggs, the gig is up. So how do you run out of eggs? Well, surgical. So you would have surgical menopause. So the moment they take your ovaries out, boom, there you go. Number two, let's say they remove just one of your ovaries. That can affect it. Don't you see how that takes some eggs? The number of pregnancies, because remember when you're pregnant, you're not releasing eggs. So if you had lots of pregnancies and lots of children, that puts off when you go into menopause because it is ovarian insufficiency. You run out of eggs. So there's familial, there's that. Then when you look at the research, the median, meaning middle, like middle of the road, technically not the middle, it's the mean. Well, the average age in the US is 51. Now, if you know research, there's plus and minus standard deviations. And yes, if you go into menopause earlier than 45, that is a significant risk factor for cardiovascular disease. But let's look at some research. Let's just look at one article. So this particular article is the timing of the age at which natural menopause occurs, which is what we are talking about. So this particular one is from 2012, but it's a good one. This will help us answer this question. There are many articles. I also try to make sure I find articles that are applicable to our country because each country, the way they view menopause, and there's so many factors I have found. So I want you to look at this little line here. In addition, women who have undergone bilateral oophorectomy under the age of 45 have been observed to have an increased risk of mortality from cardiovascular disease. So what I'm saying is, if you do go into early menopause because of surgical, we do have to care more about your heart and we have to pay attention. But let's look at another line in this article. The median age at menopause among white women from industrialized countries ranges between 50 and 52, and at an onset of perimenopause is 47.5 years. Now, menopause can come on at various times for various countries, your culture, ethnicities, how many babies you had, family. There is a lot of variables, but the average age when you look at multiple articles will be this 50 to 52 range. Most people state 51. Now, perimenopause can last 7, 10, 15 years. So you take this number and you back it up. But do you see what I mean? If your perimenopause can last 15 years, let's say that's a long haul sentence. I shouldn't say the word sentence. I'm being funny. I shouldn't be funny. But this is why I'm talking about this. Like, girls, like when you hit 40, I'm not trying to give you panic. I'm trying to give you awareness. I believe education is power, and many people don't even know about perimenopause. They don't know that they could be going through it and they could be suffering. And I want you to have the knowledge that if you don't feel right, then I want you to tell someone, and I want you to know, hey, you're not crazy. Your deep sadness that you feel, that depression, that anxiety, could be perimenopause. The joint pain you have that nobody can figure out could be you losing hormones. There's like a host of things. Women are not little men, and our hormones matter. And if you are suffering and nobody can understand why, and you fit this age group and some of these symptoms sound like it, I want you to talk to someone so that you can feel better. But everybody's age of menopause is varied, because it is ovarian insufficiency, and when you run out of eggs, the gig is up. Hit the plus sign and follow for more women's health and wellness tips. Bye.